public segment of meeting number 24 of the Public Accounts Committee. Just really quickly, for those witnesses who have joined us, I'm sure you're already very much aware that when you're attending virtually, there are interpretation services available for this meeting at the bottom of your screen, for English or French. That the use of headsets with a boom microphone is mandatory for everyone participating remotely unless there are exceptional circumstances. And let us know if you're experiencing any technical difficulties, and we will suspend the meeting to make sure that everyone is able to participate fully. Having said that, and having done it very quickly so that we can get to our meeting as quick as possible, I would now like to turn the floor over to the Auditor General concerning the reports that were tabled on March 25th. Ms. Hogan, you have the floor.
Madam Chair, I am pleased to be here to discuss our audit reports, which were tabled in the House of Commons on March 25th. I am accompanied by Carol McCullough, Philippe Le Goff, Chantal Richard, Joanne Schwartz, and Nick Swales, the principals who were responsible for the audits. The reports presented were the first of many audits on the government's response to the COVID-19 pandemic that my office will conduct. I also provided Parliament with our report on the Investing in Canada plan. There is no doubt that the COVID-19 pandemic was an all-hands-on-deck emergency the world over. Governments had to mobilize quickly to respond to the public, health, social, and economic effects of this pandemic. Canada was no exception. Nous avons constaté que le gouvernement.
Well, we found that the government was not as ready as it could have been for a pandemic of this magnitude. The public service mobilized, prioritized the needs of Canadians, and quickly delivered support and services. We did not observe the same service mindset and interdepartmental coordination in our audit of the Investing in Canada plan, which I will turn to first. The Investing in Canada plan is important because the government is investing $188 billion to generate long-term economic growth, improve communities' resiliency, support the transition to a green economy, and improve social inclusion and socioeconomic outcomes for all Canadians. Infrastructure Canada is unable to present a full picture of results achieved and progress made under the Investing in Canada plan. We found that the department's reporting excluded almost half of the government's investment because it did not capture more than $92 billion of funding that was committed before the plan's creation in 2016.
Infrastructure Canada's reporting captured only some programs each year, making it impossible to compare results year over year. The clarity of reporting was also impacted by inconsistent information received from federal partners in the plan. The absence of clear and complete reporting on the Investing in Canada plan makes it difficult for parliamentarians and Canadians to know whether progress is being made against the intended objectives. The issues affecting the Investing in Canada plan are not new. We have seen similar problems in many past audits in areas that require cross-departmental or cross-jurisdictional collaboration, such as Indigenous issues and climate change. This audit is yet another example of the need for the government to act on known issues. In this case, the need for broad collaboration and clear reporting on results for this large initiative. In contrast, we observed nimbleness during our audits of the government's COVID-19 response. Je vais parler d'abord de la prestation.
I'm going to turn first to the Canada Emergency Response Benefit. With this benefit, the government wanted to quickly deliver financial support to eligible individuals. We found that the Department of Finance Canada, Employment and Social Development Canada, and the Canada Revenue Agency rose to the challenge and quickly analyzed designed and delivered the Canada Emergency Response Benefit. To simplify the process and get support to people quickly, Employment and Social Development Canada and the Canada Revenue Agency took the approach of relying on personal attestations and automated prepayment controls to validate applicants' eligibility. Once the benefit was launched, they introduced additional prepayment controls to limit potential abuse.
Rely on personal attestations, post-payment verification becomes very important. Employment and Social Development Canada and the Canada Revenue Agency are working to start their post-payment verification efforts related to the Canada Emergency Response Benefit later this year. Their work in this area will be the subject of a future audit. Turning now to the Canada Emergency Wage Subsidy, we observed a similar focus on getting help out quickly, in this case to businesses. Once again, the Department of Finance Canada and the Canada Revenue Agency worked together within short timeframes to support the development and implementation of the Canada Emergency Wage Subsidy. The design and rollout of the subsidy highlighted pre-existing weaknesses in the agency's systems, approaches, and data. These weaknesses will need to be addressed to improve the robustness of Canada's tax system. Afin d'accorder la priorité au versement.
To prioritize issuing payments, the agency chose to forego certain controls that it could have used to validate the reasonableness of subsidy applications. For example, the agency decided that it would not ask for social insurance numbers, though this information could have helped prevent the doubling up of applications for financial support. This decision limited the agency's ability to perform prepayment validations, as did the absence of complete and up-to-date tax information that it would have helped it efficiently assess applications. I am now going to turn to our last audit, which focused on pandemic preparedness, surveillance, and border control measures. In this audit, we found that the Public Health Agency of Canada was not as well prepared as it could have been to respond to the COVID-19 pandemic. Not all emergency and response plans were up to date or tested, and data sharing agreements with the provinces and territories were not finalized.
Relied on a risk assessment tool that was untested and not designed to consider pandemic risk. The agency continued to assess the risk as low despite growing numbers of COVID-19 cases in Canada and worldwide. In addition, the Global Public Health Intelligence Network did not issue an alert about the virus that would become known as causing COVID-19. I am discouraged that the Public Health Agency of Canada did not address long-standing issues, some of which were raised repeatedly for more than 2 decades. These issues negatively affected the sharing of surveillance data between the agency and the provinces and territories during the pandemic. While the agency took steps to address some of these problems during the pandemic, it has much more work to do on its data sharing agreements and its information technology infrastructure to better support national disease surveillance in the future. We also found that the Public Health Agency of Canada and the Canada Border Services Agency implemented restrictions at the border and quarantine measures. They provided guidance and tools to inform travelers and essential workers coming into the country of public health requirements. Toutefois, l'Agence de la Santé Publique.
However, the Public Health Agency of Canada had not contemplated or planned for a quarantine on a nationwide scale, from the collection of travelers' information through to all enforcement activities, including following up on those identified to be at risk of non-compliance. As a result, The agency doesn't know if the majority of travelers properly quarantined. These audits looked at programs that were rolled out in record time. Faced with a pandemic, the public service focused on the pressing outcome, helping Canadians.
The pandemic has shown that when the public service must, the public service can. This crisis has highlighted the importance of dealing with known issues, whether it's agreeing on which organization has the lead, who will do what when, who will report what to whom, or replacing outdated systems or processes and addressing issues in data quality. These are not problems that you want to have to deal with at the same time that you are focusing on helping people, because this is not an efficient way of working, nor is it a productive way to serve Canadians. Government organizations need to do collaboration better. Madam Chair, this concludes my opening statement. We are now pleased to answer questions that you may have. Thank you.
Thank you very much, Ms. Hogan. We will now go to our first round of questioning. We will start with Mr. Lawrence for 6 minutes.
Actually, I'm going to hand it over to Mr. Weber for the first 6 minutes there.
Great.
Thank you very much.
Thank you, Madam Chair, and thank you, Ms. Hogan, also for your wonderful work and your staff and the good work that you do. I do want to focus on a couple comments you made in your opening remarks. In particular, the Investing in Canada plan remarks of $188 billion planned for that plan. You indicated that you found that the Department of Infrastructure Canada, their reporting was very poor. They excluded almost half of the government's investment. They did not, you say they did not capture more than $92 billion of funding. I find that incredible, the fact that they cannot report on these amounts. And you mentioned the absence of clear and complete reporting on the Investing in Canada plan makes it difficult for parliamentarians and Canadians to know whether progress is being made against the intended objectives, and that's absolutely the case. What reason do they give you for this absence of clear and complete reporting when you do the audit?
Thank you for the question. When we looked at the Investing in Canada plan, I think it's important to highlight that it includes 3 buckets of information. It's projects that were announced in the 2016 budget, those in the 2017 budget, and then a group of projects, which we'll call legacy projects, which represent half, or the $92 billion that you mentioned, which occurred before, or were announced before the Investing in Canada plan was launched. And so the horizontal initiative, which includes over 20 federal departments, because it didn't include those legacy programs when it was designed, they were not conceived in order to be able to report against the objectives of the plan. So that makes it difficult when half of the information isn't designed in such a way to be able to demonstrate whether it's achieving the objectives. What we then saw is that there was also inconsistent information coming from the federal partners. They weren't always reporting in the same fashion. And in fact, Infrastructure Canada was not reporting year after year against the same projects or against the same measures. And hence it was confusing in order to be able to identify whether or not progress was being made. And that's why we have many recommendations in the report to highlight the importance of outlining the clear measures of progress, and then ensuring that all the partners can report against those on a regular basis.
So these recommendations that you come up with year after year, you indicate here that you see these similar problems occurring in many past audits as well. And I guess my question is, have Infrastructure Canada come to public accounts in the past to answer these questions and why they're not following the recommendations from the Auditor General?
So I'm not exactly sure if Infrastructure Canada has appeared before any of the committees to discuss the Investing in Canada plan. I encourage the Public Accounts Committee, as well as any committee that might like to study the plan, to do so and invite ourselves as well as the department. I guess what I'd like to highlight is about what we've seen in prior audits. It relates to the fact about a horizontal initiative. So an initiative that cuts across many federal departments who receive the same funding with a common objective. And then one department, in this case, infrastructure, is put in charge or is the lead. It's really difficult for that department to compel other deputies to do certain things. And hence, it underscores the importance of, at the beginning of a horizontal initiative, to really have clear roles and responsibilities, good accountability, and good reporting mechanisms in place so that you can get meaningful information about a program that requires so many federal departments to be involved in.
I see. That could be a department then that we may want to consider colleagues to bring in for some questioning. With regard to your other audits and the record keeping within this past year during this pandemic, we know that many public servants have been working from home, and they, of course, have tried to play catch up, of course, with these IT issues, working from home and such. Do you feel, AG, that this has caused any record keeping issues with regard to your other audits?
I believe every federal department and organization, and I think it would extend even beyond, struggled at the beginning of the pandemic to figure out what to do at home, whether you had hybrid, some folks in your office and some at home, changing the process, digitizing information, taking manual processes to electronic or processes. What we've seen is that we needed to be creative sometimes in gathering evidence or accepting evidence that we maybe didn't accept the year before because it's in a different form or in a different way. But everyone works very hard at doing their job and documenting well what they do and being accountable and transparent. And so while we've seen delays, we really haven't seen the inability to carry out any audit work.
Did you uncover any privacy or information security issues at all?
Just a very short answer, please. We are past time.
So normally our audits have a very different focus, but when we do see that kind of potential violation, we would make any deputy head aware of it immediately.
Great, thank you.
Thank you very much, Mr. Weber. We will now turn to Ms. Yip for 6 minutes.
Oh, sorry. I was saying that she would fill in at the last slot. I'm going to go first, if that's okay.
My apologies.
Thank
Mr. Longfield.
Thank you, Madam Chair. And Ms. Hogan, thank you, and to all the staff that are here today. And thank you in particular for pointing out the amazing job that the civil servants have done throughout COVID. I look at it like the Apollo 13 movie, where they really had to solve problems as we were flying the ship, and using all the resources of bringing people out of retirement and working with external contractors to get us to the point where we needed to get to serve Canadians. And so thank you for pointing that out. I'm on the infrastructure questions, more like Mr. Weber, but possibly a different tack. As a member of Parliament, one of my challenges has been to have my community aware of the infrastructure projects, have the City Council approve use of land, having the province include our projects in their priorities. So it's almost a balancing between getting our City Council to apply in for projects or our business community to apply in for projects. Priorities then go to the province. Those priorities then come to the federal government. Projects get approved. Then the province has to do matching funds, then the City Council has to do matching funds. It's quite a job for a member of Parliament to try to track through the system to make sure that projects are on track through the different orders of government. In your sixth bullet point, you talk about the federal partners in the plan, and these are the partners that I'm working with on a cross-jurisdictional collaboration. a flow chart would be an amazing thing, or a spreadsheet to say this order of government has approved, this order hasn't yet, this one hasn't. I think we've got some of these legacy projects that are stuck somewhere in the flow chart. Is this an accurate assessment, or is that something that you're recommending back, that we establish more stringent records between orders of government?
Your question highlights, I guess, the importance of really working with cross-jurisdictional governments. And while there's 20 federal departments that are part of this horizontal initiative, as you correctly point out, there are so many provincial and municipal governments who are actually carrying out the projects. Because one of the things I would like to highlight is not all of the Investing in Canada projects are infrastructure projects. Some are services as well, and so you won't necessarily always see bricks and mortar. We do believe that it was difficult to come up with a complete list, and that a better reporting back to Canadians is absolutely needed. You will note on Infrastructure Canada's website that they have started a spending summary, which highlights projects and when spending has been incurred. There's about 65,000 projects that are included in there, and comparing it to a detailed list of projects that has a different number. So again, confusing information, and that's why we recommended that really being able to ensure which programs and which projects are in the plan, and then reporting consistently against them is definitely needed in order to have more clarity and visibility, in order to also measure whether or not this plan will meet its intended targets by the end, which is 2028. Right?
So I meet regularly with our mayor and with our member of provincial parliament. I've got a riding where we all share the same boundaries, which not all members of parliament have that benefit. When we're doing that, we can keep track of each other's activities quite easily, and not easily, but we can do it. When we're working across municipalities, across provinces, are you working with the other auditors general of provinces to flag this as a concern that we need better accountability between orders of government so that we can do a better job federally of keeping track of things? Is that something that auditors general discuss?
So I meet very regularly with my provincial counterparts. We meet almost once a month, I would say, to discuss what our plans are and so on. And in instances, we do raise issues of common concern. The Investing in Canada plan is not one of those instances that we have talked about. We have talked about pandemic preparedness, about vaccines, and so on. But I think what you're highlighting is the need to recognize that federally, the government can only monitor what provinces and municipalities are doing, but some of the responsibility is on those other levels of government in order to, in a timely fashion, report back whether or not they've spent funds. And that is, I think, about outlining clearly accountabilities and roles and responsibilities at the start of a horizontal initiative.
And that's exactly what I'm highlighting. And vaccine accountability, where we're shipping vaccines, how are they getting delivered? How are hotspots being identified? I mean, there are other things outside this audit that really require accountability back to the federal government so that we can do our job.
And we saw a lot of that in our pandemic preparedness audit. And I alluded to the conversation that I've been having with the provincial auditors general about actually coordinating work around vaccines. Our office is planning on beginning a vaccine audit later this year. And I have been talking with the provincial auditors general about picking up the part of vaccination where the provincial governments pick up that responsibility, not so that we'll do our work together, but that we can coordinate the timing of when we release those reports in order to give Canadians, parliamentarians, and provincial legislatures a really comprehensive picture from vaccine approval all the way to shot in the arm. It's something that I would need to do and coordinate with the provincial auditors general.
Thank you. And thank you, Madam Chair, for the extra seconds. I appreciate that.
Thank you very much. We will now move to Ms. Vignola for 6 minutes.
Merci beaucoup, Madame.
Thank you very much, Ms. Block. Ms. Hogan, thank you for being here with us once again. I'm replacing my colleague, Maxime, who sends his regards. He's in a virtual event in his riding, so he sends his cordial regards. I was really struck when I read your reports, particularly as concerns the state of readiness for the government to face a pandemic, such as the one we're living or experiencing now. Because after all of the warnings with SARS, it doesn't seem possible that a country who had heard those warnings would not be ready. Canada was an example to the world for these kinds of disaster scenarios. It just seems incredible to me that we wouldn't be ready. And yet, you've seen it, as I probably should have, that Canada wasn't ready. So to what degree do you think that the Public Health Agency of Canada would be able to recover its reputation and with the modeling and et cetera? I think I'd begin by just saying giving a little summary, perhaps, of the report to give you an indication of what we found with the Public Health Agency of Canada and the fact that they weren't as ready as they could have been. I will then speak about what they could have done. We really looked at 4 areas where they could have been better prepared. First of all, emergency plans were not up to date, and more importantly, the federal, provincial, territorial plans had not been tested. We saw that there were shortcomings in terms of information sharing between the various levels of government on health information, and we also saw or found that there was a risk assessment tool that hadn't been designed to consider the situation of a pandemic. And the agency finally hadn't planned a national scenario for quarantine. What we saw was that, yes, following SARS and H1N1 and following several reports that we published in 1999 and 2002, the agency was aware of these long-term shortcomings that they should have addressed. So what this shows me is that we're not putting a lot of emphasis or value on the whole concept of being ready, investing in systems that are invisible to people, to test plans so that we can identify the weaknesses and shortcomings in them. And it's something that we don't realize is so important until we're faced with another emergency. So the time to emphasize that is now, and that's really for across the country. We need to be well prepared. We have to consider all aspects of a health emergency that's national in scope, and we can't wait until we are facing the next pandemic to do so. But I also have to emphasize that officials worked very hard. They reacted. They really tried to overcome the shortcomings that they were faced with, but it's really time to put the emphasis on being better prepared for the next time around. Thank you. Should we fear, and I'm listening to what you've just said, should we fear the results of too much red tape? Because it seems like there's just too much bureaucracy surrounding all of this. So what we're currently experiencing, is it a direct consequence of having set aside or pushed out so many scientists, which the government some 10 years ago did? They really pushed scientists out of decision-making roles. Well, during our audit on pandemic preparation, we didn't look at the administrative side really, or at the staff within the agency in order to identify if there was a lack of staff or there had been too much of a turnover in staff that resulted in these shortcomings. In my opinion, it's really rather the fact that's not what people are focusing on, as I said, on those systems that people don't see to be better prepared. I think almost no country was as ready as they might have been, and that's not really an acceptable position for us to be in. Thank you. I'll continue with the Investing in Canada plan. I find that quite troubling that these documents weren't accessible. Managing public funds. I don't want to be alarmist, but I think that there are many ins and outs with this program that are questionable. So, do you have the moral assurance that you will be able to audit the whole program? I think it's huge. There was a job done by Ms. Fraser some years ago. And I would like to have you reassure me that there will be a follow-up done by your organization. This will be a hard job to do. And is your organization ready to face that huge challenge? Well, our organization is always ready for the challenge of auditing big and small programs, whether they involve one department or several departments. We're very happy to let you know that we have got the increased funding for our budget that we asked for. And we are undertaking the task of increasing our staff so that we'll be able to do follow-ups as well as audits in the future. Thank you.
Nola. We will now move to Mr. Green for 6 minutes.
I just want to begin with what I believe to be a summary of the findings, and then I'll ask Ms. Hogan to comment that essentially government inaction led to lack of preparedness. That there were key elements of a pandemic response, including things as basic as ensuring that PHAC received timely, complete, and accurate information about COVID-19 cases that were not in place. PHAC failed to conduct formal pandemic risk assessments once required to do so, which was a serious error that led to systematically underrating the risk until they were already in a full-blown pandemic, which was, a fatal mistake. And that PHAC failed to prepare for nationwide quarantine measures and led to wholly inadequate capacities to follow up with travelers and with law enforcement agencies. Ms. Hogan, you referenced SARS and H1N1, and we heard my colleague talk about perhaps there being too much red tape and bureaucracy. I would argue that scientists are in our bureaucracy, and that based on our own knowledge and our own reports and our own recommendations, all of this had been ignored. Would you care to comment on what I have summarized as principal failures? Would you agree with them, and would you care to expand on them?
The way I would summarize our audit report on the pandemic preparedness is very similar to how you would, is that the agency was not as well prepared as it could have been in those 4 key areas. There was some work done, so I do think it's a bit of a balance, right? So there was some work done on emergency plans, but they had not been updated for quite some time, which is not okay. And more importantly, the major response plan, federal, provincial, territorial one, had not been tested. And testing of a plan is incredibly important to identify gaps or weaknesses or lack of capacity. Definitely the long-standing issues about data sharing impacted the country's ability to respond in a timely way to the pandemic. For many years, it had been known that agreeing to ways to share information between the federal, provincial, and territorial governments was needed, including the infrastructure, the IT infrastructure to handle such volume. None of that had been addressed prior to this pandemic and needed to be addressed and find solutions during the pandemic. The third thing was the risk assessment tool. So while they did use a risk assessment tool, we found that it was not a tool that considered a pandemic risk. So what does that mean? Well, it only considered once the virus was here, how it might spread, and not necessarily the risk of the virus coming here and then spreading. So sort of that forward-looking pandemic risk that is needed. And hence, as you say, kept the risk rating at low until the Chief Public Health Officer in mid-March stepped in and asked that it be elevated. And then finally, they hadn't contemplated for such a scale of a quarantine. There had been quarantines in previous health crisis, but not to this magnitude. Again, the agency knew that it didn't have the capacity, hadn't pre-planned for dealing with that, and then had to ask for support and help during the pandemic, and unfortunately ended up in a place where at the beginning they were unable to tell us whether or not 2/3 of travelers had properly quarantined. So I do believe it highlights a few things. One, the importance of the value of planning and being better prepared. We shouldn't underestimate that. And secondly, I think it also helps highlight when you use tools or machine intelligence, like they did for the risk assessment, that human judgment needs to be applied to it in order to make sure that it's thinking about all of the factors and not just the ones that might have been inputted into the tool.
I still, while appreciating, I can't reconcile the fact that coming out of SARS, I think about the absolute abject failures, the scandal of our national emergency strategic stockpile and the way that all of those key elements were discarded in 2019. PHAC's failure to prepare for nationwide quarantine measures. I just can't imagine how coming out of SARS and H1N1, having read, I believe Dr. Tam was actually involved in these preliminary reports, how they've just completely and utterly failed to address the progress on the recommendations that have been made from past audits.
I mean, your reaction is one that I highlighted in a message that I gave to Parliament, right? Which really underscores the importance of acting on known issues. Many of my predecessors, and if I use even a different example other than pandemic preparedness, if I look at Indigenous matters, many of my predecessors have been raising concerns around Indigenous matters. And my first reports earlier in February did the same thing. And so I think this is an aspect in pandemic preparedness that we've highlighted all the way back to 1999. And so it is, I think, the fact that some of it is what we'll call back office, right? Having plans in place and doing a tabletop exercise doesn't seem that relevant, but it really is, because it highlights exactly some of the matters that we lived through in the early stages of the pandemic and would have allowed the agency to hopefully change its response. Unfortunately,
I'll just share this. I'll just share this in my closing remarks here, that we're in the third wave. We're a year and a half into this, and I have deep concerns that this government, and all levels of government for that matter, provincial and territorial as well, are still completely and wholly incapable of dealing with the variants and the ways in which this is mutating. So I do have grave concerns, and I appreciate the fullness of this report. Thank you, Madam Chair.
Thank you very much, Mr. Green. We will now move to our second round of questioning, starting with Mr. Weber for 5 minutes.
5 minutes. Thank you, Madam Chair. Ms. Hogan, I need further clarification on some comments you made in your opening remarks, in particular with regard to the Canada Emergency Wage Subsidy, some comments you made there. Now, I know it was important for Finance Canada and Canada Revenue Agency to get the help out quickly to these businesses throughout our country. It was vital, absolutely. But you had indicated some concerns, in particular with the subsidy applications, with these businesses filling out these application forms to get their funds. And you had indicated here, you said to prioritize issuing payments, the Canada Revenue Agency chose to forego certain controls that could have been used to validate the reasonableness of subsidy applications. And then they gave an example that the agency would not, they decided not to ask for social insurance numbers. And, this information could have helped, you say, to prevent the doubling up of applications for financial support. So I guess my question is, why did they choose not to ask for social insurance numbers? And so what did they use then to prevent the doubling up of applications for financial support?
So thank you for the question about the Canada Emergency Wage Subsidy audit. What we did find here was that the Canada Revenue Agency and Department of Finance worked in really tight timelines to design a wage subsidy, one that's never seen in Canada before. The goal of that subsidy was to try to maintain the employer-employee relationship, to keep individuals working and to allow businesses to be better prepared for the reboot of the economy. The focus in this case, as well as in the Canada Emergency Response Benefit, was on getting payments out in a timely way. The government chose what is known as an international best practice in emergency situations to focus less on prepayment controls, which they typically would do to vet eligibility and applications, and get money out in order to provide support and focus on post-payment controls. And so that just underscores the importance of the post-payment work, and hence why in both of these programs, my office will go back and do audits to look at that post-payment work. What we saw here was when they chose not to ask for those social insurance numbers in the example that you asked was for a few reasons. One, it highlighted the fact that their IT systems had some weaknesses and they couldn't handle some of the data and the cross comparability. It highlights the lack of timely tax information in that they weren't able to vet beforehand revenues from the prior years, since so many filers had not filed, for example, their GST return, which would have provided evidence of revenues the year before in order to demonstrate a decline in revenues. And so really the decision was made by the Canada Revenue Agency to prioritize support and to deal with all of these potential issues through their post-payment verification work. And they've noted that that will take several years to get through, and hence why we will be auditing it early on to make sure that it has some good controls and some good mechanisms in place.
I see. So you say that the agency did not do any type of control at all with respect to these applications. They just basically gave what was asked basically from the application.
No, they did have some automated prepayment controls up front. Both the wage subsidy as well as the Canada Emergency Response Benefit had a few up front, but not the typical stronger due diligence they would have done normally when handing out subsidy payments. So it means that there is a potential that some payments were made in error or to ineligible applicants, which will have to be identified and then recovered.
Well, I certainly hope you can identify the ones that weren't qualified for the payment. But good luck in your future audits with regard to that. I do have constituents who certainly benefited from the Canada Emergency Response Benefit in the past, and I'm now dealing with some who have to pay some of that back through the post audit that they're going through now with the CRA or whoever is dealing with the post audit on that, and they're finding it very difficult to return that money. But if it's required, then yeah.
Thank you.
Oh, I'm sorry, that is it. Okay, all right. Well, thank you, Ms. Hogan.
Thank you very much, Mr. Weber. We will now move on to Ms. Yip.
Thank you, Ms. Hogan, to you and your team for doing these COVID audits so quickly, responding to what the public wants to hear instead of choosing other reports. Was there another, or was there an explanation given by the Public Health Agency why the longstanding issues were not addressed for 2 decades?
I must admit, I'm not sure that we actually got an answer there. I think they will highlight that they did some work, that like many federal organizations, they had some capacity issues, and that like anyone, you start to prioritize the issue at hand versus doing that preparedness. And as I say, that just in my mind really underscores the importance of us as a country having to put some value on being better prepared. We all too often forget that, and this just highlights the need to have that done better going forward.
I know that Ms. Vignola had mentioned bureaucracy. Do you think that this could also be because it's the bureaucracy is too large and it's just a matter of passing the buck from one agency to, like, from one government to another over time?
I'm not sure that I could comment on, I guess, the different, aspects that might drive what priorities an agency has. I go back fundamentally to why the Public Health Agency was created, and it was to help inform a nationwide response following a health crisis, and this is their bread and butter. And so they need to help support the country and work with their provincial counterparts in order to ensure that we have a much better coordinated response the next time we are called into action to respond to a crisis.
In terms of the Public Health Agency of Canada and the Canada Border Services Agency implementing restrictions at the border and quarantine measures, you said in your opening statement that the Public Health Agency had not contemplated or planned for a quarantine on a national basis. Do you feel that it was a matter of not collaborating better?
So I think I'll start with the positives that we saw at the border and then talk about the areas that were not so positive and areas for improvement. We definitely saw that the Canada Border Services Agency worked and collaborated well with the Public Health Agency of Canada to define guidance and measures on applying exemptions and providing information to travelers who entered the country. Where the public agency had not been as well prepared as it should have been was enforcing this mandatory quarantine nationwide. They lacked some capacity, and so they did seek some help from other federal agencies and at times local law enforcement. But where they were missing was they hadn't contemplated even how to gather traveler information. At the beginning, it was done in a paper-based format, and then later on transitioned to an automated tool. But there was, basic missing information and the inability to reach some travelers. When they triaged travelers and identified some at high risk for maybe not complying with the mandatory 14-day quarantine, they referred a portion of them to local law enforcement, but then didn't follow up with local law enforcement. And hence why they were just unable to tell us whether or not the mandatory quarantine was effective if individuals were actually complying with it. And so it is really a lack of preparing for such a wide, broad scale response and the best way to monitor it and follow up with it.
Out of all the COVID reports that you've tabled, which report stands out the most in terms of what the government should pay attention to in order to make changes to better deal with the ongoing pandemic?
A very short answer, Ms. Hogan.
I think I'll highlight a positive and a negative really quickly. Positive, the focus on service over process. Really, that mindset is one I hope will drive what the public service will look like in the future, because it was really an excellent way when we look at the wage subsidy and the emergency benefit. When I look at pandemic preparedness, what I hope we'll learn is, as what I've mentioned before, the value of actually being prepared and addressing these long-standing known issues. I shouldn't have to come back and repeat findings year after year. We should take care of them.
Thank you. Thank you, Ms. Hogan. We have our last round of questioning, starting with Ms. Vignola for 2.5 minutes.
Merci beaucoup. Thank you very much, Ms. Hogan. We had to be a bit brief with my last question, so could you complete your response in terms of level of preparedness for the challenges faced and the benefit of your audits for people in terms of the agencies concerned? Is it satisfactory in your opinion? Thank you for the opportunity to finish that answer. And indeed, we received $25 million extra in our budget. Since the month of July, we have started to hire people to increase our staff. We have hired some 100 people. And we took the opportunity to hire people across the country. At least a quarter of the people we hired are in regions where we don't have offices. So we are really taking the opportunity to let people benefit from virtual work, people who might not in the past have had access to our offices. So I feel like I'm on the right path to be ready as an office to respond and to complete more audits in the future. I think we have the intention of doing more follow-ups, and we intend, with the audits that we've already completed, but also those related to the pandemic, as well as audits on other very important subjects. So we're in the process of training all of these people, welcoming them to our office so that we can really see an increase in the number of audits that we can table in Parliament. In terms of collaboration with departments, I see a great urge to collaborate with us from the part of the departments. A lot of departments just have a lack of capacity. People who are dealing with the pandemic are also the same people who should support us in our audits. And so we've received a few requests to delay audits, and we took the decision to do so, but to replace them with other important subjects.
We will now finish up with Mr. Green for 2.5 minutes.
Thank you. I'm still stuck, on the report that PHAC's rapid risk assessments did not consider the pandemic risk of this emergent infectious disease or its potential impacts. What rationale do they give you when you do this audit and you're going back and forth with them? Do they explain or at least try to address that really significant a material shortfall?
I guess I would highlight a couple of things in that response. I'll highlight maybe the Global Public Health Intelligence Network as well as the risk assessments. And so the agency has noted to us that they completed risk assessments. However, we believe that they didn't use the right risk assessment because they didn't consider pandemic risk. Again, I would highlight here that the Chief Public Health Officer, however, recognized the importance of what was going on globally as well as in the country, and then questioned the assessment of that tool. The tool they were using was one that was in a pilot stage that had not really been tested. And so I think it highlights for them the need that they have to refine that there should be a normal risk assessment tool, but you do need a different tool when it comes to pandemics because you need to think about that forward-looking nature. If I look at the Global Public Health Information Network, that network issues two reports, a daily report and an alert wasn't issued. I really think that that one should have been, and I'm not sure, and it's not clear why one wasn't issued. I see a huge difference between a daily report and an alert. But again, I will credit the Chief Public Health Officer following a daily report signaling to her provincial counterparts that they needed to start meeting and start looking at a countrywide response. But I do think that the department needs to figure out what they expect from that network, make it clear, and then use it as intended.
Well, I just know that this, provincially, we had a, conservative premier talk about how they were waiting and seeing if the modeling actually resulted in hospital beds and ICUs. And yet I go back to PHAC, who, as you've stated, was not adequately prepared to respond to the pandemic, and it underestimated the potential impact of the virus at the onset. Was there not international modeling based on experiences in places like China, which would have predicted the outcome in Canada?
A very brief answer, Ms. Hogan.
So I'm going to very briefly maybe throw that to Ms. McCullough. I think that she did some of the work more specifically on risk assessment and might be able to give you a better answer.
Thank you. So the risk assessment is called for in PHAC's pandemic plans. The WHO did issue a risk of a pandemic risk and call attention to the global community of the risk of COVID-19, but we found that at that time, FAC did not update its risk assessments and only did so in the mid-March at the direction of the Chief Public Health Officer.
So there was an alert. We were alerted to this in advance.
By the WHO, yes.
My God, thank you. Madam
You're
Block,
on
you are
mute,
an
Madam Chair.
you're an exceptional chair, and you are doing a fabulous job. But I like
My
you more when you're
apologies.
unmuted.
My apologies. Thank you very much, Mr. Green. Thank you to all of you for your very good questions and to our witnesses for appearing here today. As you all know, we will be able to do a much deeper study into each one of these reports going forward. And with that, next Thursday, the committee will be studying Report 6, Canada Emergency Response Benefit. Is the committee in agreement to adjourn the meeting? We are adjourned. Thank you.